Today we're going to talk about the effects of ultrasound therapy with taping, PNF training, and PNF training with taping in treatment and rehab of sports injuries of high ankle sprain. Some background for the article is that ankle sprains are among the most common ligamentous injuries across all sports and often lead to associated injuries that can go undetected. It is also shown that ankle rehab can be inadequate to reduce the reoccurrence rate and truly strengthen the ligaments. Ultrasound therapy depicted at the top left of this PowerPoint has both thermal and non-thermal effects, effective for soft tissue healing. The thermal effects are due to when the sound waves from the ultrasound are absorbed within the tissues, and the non-thermal effects occur whenever bubbles are created in the tissue, which then leads to cavitation and microscreaming, ultimately leading to the tissue healing. PNF depicted at the lower left half of this slide is used for a quick increase in range of motion as well as neuromuscular control early in rehab. The purpose of this study was to determine the effects of ultrasound therapy with and without taping and PNF techniques with and without taping in response to high ankle sprains in the acute stage. They used a random controlled trial of 50 high ankle sprains separated into 5 groups of 10, the groups being ultrasound therapy with and without taping and PNF therapy with and without taping, as well as a control group with RICE method, which is rest, ice, compress, and elevate. Swelling was measured in centimeters prior to the treatments. Treatments were then done for 15 continuous days, and then swelling was again measured post the 15 days. In this table, you can see that I have provided the pre-test and adjusted post-test numbers. The adjusted post-test numbers were used with the ANCOVA model with a 0.05 hypothesized number for the post-test adjusted calculations. Here you can see that most of the 4 therapies that we have are around the same range from pre-test to post-test. However, RICE only decreased from a 65.75 centimeter average swelling to a 64.93 centimeter average swelling. All of these are averages of each of the 10 people in each group. From this study, the ANCOVA model was used to adjust the calculations, as well as a Hock analysis was then used to determine the significance of each calculation. And while there were significant improvements with the adjusted post-test numbers, there were not significant improvements with the pre-adjusted numbers. However, significant swelling was reduced in comparison to the control group, as stated previously, but not as much statistical difference was found between the treatment types. So my application of this article would be that ultrasound therapy with and without taping and PNF techniques with and without taping all may be similarly effective in reducing swelling and high ankle sprains when compared to the RICE method. My only critiques for this article are that they only used high ankle sprains and only had 10 subjects per therapeutic modality. However, they also did not specify whether these were healthy subjects, current athletes, active, non-active, etc. For future studies, I would test other injuries such as MCL sprains in the knee, UCL sprains at the elbow, or also testing specific subjects. So for me, my subjects would most likely be current collegiate athletes. However, I could also do healthy subjects or older subjects, as well as I would hope to increase the number of subjects that I would be testing as well. And that's my article.